By now, you should have had your chat with the chemotherapy nurse or specialist like me about the symptoms to watch out for during your chemotherapy. If you haven't, pause this video and watch it once this is complete. Your chemotherapy support team believe the portable home monitoring device will really benefit you and help smooth your journey through your upcoming chemotherapy. It will help reassure you and hopefully help you have a better understanding of your symptoms during the treatment. It's not designed to replace any of your routine care or your relationship with you and your nurses and doctors, but looks to support you and them with more complete information of your well-being. Our vision is to improve the experience patients have during chemotherapy by reducing unnecessary journeys, relieve anxiety and stress, and provide reassurance during and between the cycles of treatment. We've designed it to be simple to use, based on proven, reliable hospital laboratory technology. So I bet you're wondering at this point, why do I need it? What does it actually do, and how do I use it? We know that during chemotherapy, it's hard for you to know what symptoms are usual and expected, and which ones are more serious and need attention from your oncology team. The home monitor continues to provide information to your doctor and nurses so they can make an informed decision on your health and ensure you and your white blood cells are recovering between treatment as expected. What does it do? It sends information on your white blood cell count, your temperature, and overall health symptoms to your support team. Most of the time, these are within the expected range of what your own doctor thinks normal, and you're sent a reassuring message. In any other situation, you'll be prompted to call your nursing contact, and at the same time, they will be informed to give you a call. This means there's absolutely no need to worry about wasting anyone's time. We'll always choose to call you if we think something's worth checking, and we will always ask you to call us if the monitor shows some important and helpful information. We might simply ask you to take the test again. This makes sure your symptoms are managed properly and safely at all times. At a time of your choosing, everything you need will be delivered. You receive a helpful setup card showing you how to plug in and prepare. Don't worry about unpacking it or setting it up if you don't want to. Just leave it somewhere safe. You just need to have it to hand when your nurse comes round to set it up. Don't worry, your nurse will ensure that your device is all there, working properly and completely accurate. She will also make sure the device is personalised to you as instructed by your doctor. They will explain the simple steps needed to check your blood and temperature and monitor your symptoms before the first time you ever use it. You'll always be able to watch video prompts on how to use it after they've gone, even if you forget. Don't worry, it doesn't hurt. Diabetic patients do it every day. The machine knows if you've given it enough blood and whether it can be analysed properly. You'll be told how to hold your hand with 2 fingers outstretched horizontally in a pointing position before lightly pricking your finger. As soon as you've pricked your finger, you'll be shown how to form a teardrop-sized blood sample. Allow the bottom of the droplet to touch the sample hole on top of the disposable cartridge. You will see there is a small red arrow marked on the top surface of the cartridge that shows you exactly where the hole is. Your drop of blood needs to be enough to fill the thin channel shown in the white circle. Done. The cartridge is then simply placed in the cartridge holder in the reader. The cartridge will automatically lower into the machine, and your blood test from this point is fully automated. Although you might be a bit apprehensive pricking your finger, there's no need. It doesn't hurt. Diabetic patients do it every day. The important bit is making sure your hands are nice and warm. It's also very simple to use and hard to get wrong, as the machine knows if you've given it enough blood to be analysed properly. How often do you actually need to check your blood and answer these questions? It could be once a day, or could be less, and it will never take more than 5 minutes. What kind of questions will I be asked by the monitor? Simple ones like how many times have you been sick, or How is your sleep? Do you have any pains? A rash? Nausea? Or fever? These are the sort of questions that don't require specific medical knowledge. Answering these will help your doctors and nurses give you better care and look after you, even when you're at home. Every day you'll be prompted to take your temperature with a wireless thermometer, so your support team can review this important measurement. 3 readings are taken to ensure greater accuracy. You should never be afraid to contact your support team if you need reassurance or feel that your symptoms are cause for concern. Remember, the home monitor is complementary to the support from your doctors and nurses, and does not replace or limit the important relationship you have with them. It simply makes everyone involved so much more aware of your symptoms and progress, so that you can be supported. Thank you for listening, and if you have any further questions, please speak to your chemotherapy nurse.